Today we're going to discuss the discipline of psychiatry in medicine. I'm Professor Willie Pienaar. I'm a psychiatrist and bioethicist in the Western Cape, University of Stellenbosch. For the heart and the vessels, you've got a cardiologist. For the kidney, you've got a nephrologist. And for the brain, you have three disciplines. You have the discipline of neurology, you have the discipline of psychiatry and psychology. Now, the discipline of neurology is a branch of medicine that deals with the anatomy of the brain, organic disorders, structural disorders, things like multiple sclerosis, like Parkinsonism, like stroke and dementias and infection of the brain, neurosyphilis, Huntington's chorea, HIV in the brain. Those are the neurologist. But overlap is psychiatry. Psychiatry is the study and treatment of mental disorders. When there's a mood disorder, there might be a serotonin problem in the brain. When there's a psychotic disorder, there might be a dopamine neurotransmitter disorder in the brain. So we look at psychotic disorders, mood disorders, anxiety disorders, substance-induced disorders, also dementias, neurodevelopmental disorders. So that is what we do in psychiatry. We treat mental disorders. In psychology, also overlap, and the three of us is actually a team that looks after disorders of the brain. So psychology is the scientific study of the human mind and its functions. Why do I react like this? Why do I think like this? Why do I suffer from this? This is mostly psychometry and also psychotherapy. To clear up the whole thing about the DSM-5, the DSM-5 is the Diagnostic and Statistical Manual of Mental Disorders. Now, there are many classification systems. If there is an ovarian tumor, it's an histological classification system. In psychiatry, the DSM-5 is a phenomenological classification system. When there ever is a group of symptoms, like, say, for instance, a post-traumatic stress disorder. For a post-traumatic stress disorder, you have this symptom, this sign, this symptom, this, and this is a cluster, a group of symptoms that you see in more patients, and you see it next week, and you can see it next month. So this is a group of symptoms. It's a phenomenon. And therefore, in psychiatry, we have a phenomenological system. These symptoms make a social anxiety disorder. This group of symptoms make a major depressive episode. And that is how we use the DSM-5. Now, please, would you help me with this? As a psychiatrist, I'm so aware of the stigma of psychiatric disorders. You know, if there's a family history of cardiac disease, it's all right. There's a family history of this disease, it's okay. Hypercholesterolemia, that's okay. But there's no psychiatric problems in my family. There's a huge stigma now. Please, you to help me fight this. You know, long ago, we all want to explain life, and we want to explain what we see, and we want to explain our relationship with others. And then some people become psychiatrically ill. But in the time of the Bible and the Quran and all the big books, there was no language schizophrenia. There was no language bipolar. There was no language anxiety disorder. But what they saw should be explained. And it was explained that these people with psychiatric disorders, they were witches, they were demonized. If we read the history, they were burned at the stake, they were set in asylums, they are mad, they are devil-possessed, they're evil, they're weak. And then the knowledge started to come. Slowly but surely, we developed the knowledge of what happens in the brain with depression, what happens in the brain when you're severely anxious, what happens in the brain if you become substance addicted, and then what happens in the brain if you start to have delusions and hallucinations when you have a psychotic illness. So please, let us move away from stigmatization and that nonsense information about demons and witches and being burnt at the stake and being frowned upon. Today we are one of the 5 major medical disciplines. We practice a science. When I treat a major depressive episode, I know what I do. When I treat a psychosis, I know what is the pathology. And the 5 medical disciplines are internal medicine, surgery, obs and gynae, pediatrics, and psychiatry. Let us get back to mental disorders. What is mental health? I am absolutely convinced that all humans are bio, psycho, social, spiritual beings. And being healthy, being of sound mind, being healthy is not merely an absence of illness, but it is a state of ongoing happiness. It's a state of well-being. So people would always ask me, why do people get mental disorders? There are 3 things that we must remember. That is the cause of illness, whether physical or mental. And the first one is the biological reasons why we get ill. Some people are genetically predisposed to a high cholesterol. Some people are genetically predisposed to hypertension. Some people get diabetes. Some people get schizophrenia. Some people get social anxiety disorder. So, all in all, we must remember that because of our genes, we are genetically vulnerable and we are predisposed. So then the other biological reasons is not only my genes, but biological, physically, infection can make me ill, physical trauma can make me ill, malnutrition can make me ill, substance abuse can change structures in the brain. The second reason why people become ill is the psychological reasons. Stress, emotional abuse, poor stress responses, lifestyle choices, ongoing stress outside the frontal lobe, but eventually also the hypothalamus, and it influences the body. So the psychological reasons why people develop mental disorders. And then, of course, the third one is the social reasons. Poverty, violence, neglect, abuse, those things that are so obvious in our country and in our community. So there is a biological reason why people get ill, psychological reason, and social reason. And remember, please, that up to 50% of people somewhere in their lives may suffer a psychiatric disorder. So if the brain gets ill, what will the symptoms be? It's easy when the heart gets ill. I know what the symptoms will be. I'll be swelling of the ankles. I'll have shortness of breath. I've got to sit upright when I sleep. So that's easy. So, but what will happen if there is a disorder of the brain? Please let us get rid of the word madness. So if we know what is the function of the brain, then the symptoms and signs must be in that function. So what does the brain do? The brain is a highly complex thing. The brain makes me aware of myself and my surrounding. I am here in a studio. It is Wednesday morning. I think it's the 8th of August. So I am fully conscious. I am aware and I can react with others. So the first huge function of the brain to make me aware of myself and my surrounding. Then there's a small area, the sensation and motor area, that can make me move and talk and articulate. It's a small area in the parietal lobe. But then the brain is much more than just being fully awake and able to feel and move. The brain is also there for feelings, emotions, my mood, anxiety, jealous, anger. It's an emotional state. So in my symptoms of mental disorders, there must be these elements of mood, emotion that may be symptoms. Then the brain is also there for ideas, thinking, responding, interacting. And if thinking can go terribly wrong and become symptoms of psychiatric disorders. And then the whole of my frontal lobe is my personality traits, hundreds of temperament traits. Who am I? How do I respond? Extrovert, introvert, it's my personality. And then my brain orchestrates all of my physiology. My appetite, I get hungry, my libido, my sleep pattern, my endocrine, my autonomic nervous system, my immune system. We know if you are severely stressed that your immune system go down. My day and night cycle, my temperature. And finally then just my intellect is a sum of them all. Intellect would integrate all these functions. Therefore, the signs and symptoms of mental disorders are going to be quite complex. There are 8 subspecialties in psychiatry. 8 subspecialties that you can study after you've qualified as a psychiatrist. So in adult psychiatry, mainly we get the psychotic people, the severely disordered people where there's no contact with reality, with delusions and hallucinations, with poor contact with reality, the psychotic people. And on the other side, the non-psychotic people, they are in reality, but finds it difficult to cope with reality. And then we get child psychiatry as a specialty, we get psychogeriatric psychiatry, the old people, forensic psychiatry that look at responsibility and accountability, substance abuse psychiatry, huge problem in our country, the substance abuse, the drug abuse, liaison psychiatry, what happens within the hospital and medicine. Neuropsychiatry is the interface between neurology and psychiatry. The dementias, we both look at the dementias. And then community psychiatry. Psychiatrists look at the following mental disorders. The neurodevelopmental disorders, that is intellectually disabled people, autism, attention deficit hyperactivity disorder, learning disorder, the neurodevelopmental disorders of children. Then 2, we look at schizophrenia spectrum and psychotic disorders, people who are schizophrenic or outside of reality contact with delusions and hallucinations. Then we get the spectrum of bipolar and related disorder, where you can be high or low. Then we get number 4, depressive disorders, where you never get a high but a repeated low maybe. Then we get anxiety disorders, and we are going to have obsessive compulsive disorders, and a new kid on the block, a group of disorders, the trauma and stress related disorders, the dissociative disorders, very rare, but we do see that. Somatic symptom disorder is a new kid on the block. That is where people will present with physical symptoms again and again. We cannot find the pathology. And then we get the feeding and eating disorders, elimination disorders, the sleep-wake disorders, the sexual function disorders, the gender dysphoria, the disruptive impulse control disorder and conduct disorders, the substance-related addictive disorders, very prevalent, huge problem in our community. I mean, tech is killing off our young people. It's a reality, and some people are genetically predisposed for the development of addictive disorder. The neurocognitive disorders like the dementias, personality disorders, the paraphilic disorders, That is a sexual disorder with abnormal amount of fantasy and other mental disorders. We also look at medication-induced movement disorders and other adverse effects of medication, and then rarely other conditions that may be the focus of clinical attention, like a very stormy marital process, or a separation process, or a bereavement process, which is normal process, but you have to help the person. So if we as psychiatrists see a patient, we first look at their consciousness, if the patient is awake, how the patient perceives the external world, the intellect, low, normal, high. If there are anxiety disorders, if there's mood disorders, if there is a disorder of thinking, is there a disorder of drive, the energy. We look at the physiology, your eating, sleeping, and we judge the insight and judgment of the patient. Mental disorders is an illness like any other illness, whether it's the liver or the kidney or the lungs or the heart. It is complex, yes, because the brain is very complex in its function. It's difficult, these symptoms of emotions and feelings and thinking. But that is the function of the brain. So we do a mental state examination. We do a lot of psychometric testing. There are scales to judge the quality of the disorder. And we have depression scales, anxiety scales, cognitive scales. We have to do blood tests. I have to know whether you are HIV positive. I must know if your thyroid function is normal, because if your thyroid function is sky high, you're going to be anxious. We have to examine the cerebrospinal fluid if there's infections. We must do CT scans to see if there are structural changes. Even in schizophrenia, there are changes. MR scans, SPECT scans, PET scans, to see the quality of the brain. EEG is still very important in psychiatry, and we always do a full neurological examination and a physical examination. I hope I have explained to you the role of the psychiatrist within the medical module is that we practice a science today, and we don't do a lot of guesswork. Thank you.